Prior to beginning the activity, please be sure to review the faculty information and disclosure statements, as well as the learning objectives. After listening to the activity, complete the post-test by clicking the Earn Credit link in the episode description. Downloadable slides and resources are also available. The following presentation is copyrighted by Medscape. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of Medscape.
The following presentation is part of a certified educational activity provided by Medscape Education and supported by an independent educational grant from Otsuka America Pharmaceutical, Inc.
This activity includes discussion of therapeutic products that have not been approved by the U.S. Food and Drug Administration, off-label uses of approved products, or data that were presented in abstract form. These data should be considered preliminary until published in a peer-reviewed journal. Readers should verify all information and data before treating patients or employing any therapies described in this or any educational activity. A qualified healthcare professional should be consulted before using any therapeutic product discussed herein.
Good morning, Marissa. It's good to see you again.
Hi, Dr. Song. I'm glad we could meet today.
Of course. When we spoke last time, we talked about how things are going at work and at home, and we filled out some surveys together. When we looked at the results, we saw that you may have ADHD with anxiety.
Yes, I remember. That's why I'm glad I could come see you again because now that we have an idea of what's going on, I would really like some advice on how to deal with it.
I understand. Would you mind if I asked you some further questions?
Uh, yes, that's all right.
Have you ever worried about losing your job? Not because of your actual skills, but because of things like missed deadlines or disorganization?
Um, well, I was convinced I was going to be fired from my job, and there was one day I didn't go to work altogether because I knew my boss wanted to speak with me.
And how did that turn out?
It was okay. She just had a question about a report I'd written, but I stressed about it for a long time before I had the courage to speak with her.
I understand. Another question. How do you react if plans you've made change suddenly? I'm not talking about major changes, but just small things, like if someone wants to change a meeting time to 30 minutes later.
Yes, I get really angry sometimes over the smallest things. If something changes, even something small, I feel like I have to reorganize my whole life and it gets overwhelming.
I can imagine that's difficult for you. And one last question. When you look at items on your to do list, if you make one, how often do you feel unable to do the tasks, even though you know you are more than capable of doing them?
I stopped making to do lists exactly for this reason. It's strange, like you said, the tasks are never huge or overwhelming, but I just can't do them. I want to do them perfectly, and I am usually so afraid of getting something wrong that it keeps me from getting started at all.
I understand. Based on the test we did last time and your answers to these questions, I believe the most likely diagnosis for you right now is indeed ADHD with anxiety.
Yes, okay, that makes sense. But what can we do about it? Is there a treatment for it?
Yes, there are a few things we can try. What I would suggest first is to try treatment with a long acting amphetamine. This is the most commonly prescribed ADHD medication, and it may also help with your anxiety. However, not every patient is the same, and this treatment may have no effect at all on your anxiety, or it may even make it worse. So, it's a good idea to meet again in a few weeks to see how you're doing.
Okay, but I have a few questions about the treatment if we still have time. I'm not sure I want my anxiety levels to increase.
Of course, please ask me anything.
Hello, I'm Dr. Ann Childress, adjunct faculty at the Kirk Kerkorian School of Medicine at the University of Nevada, Las Vegas, and also Touro University of Nevada, College of Osteopathic Medicine. And I'm president of the Center for Psychiatry in Behavioral Medicine. Today, I want to talk a little bit about the role of monoamines in ADHD. The story is a lot more complicated than we thought about 20 years ago. It was dopamine and then dopamine and norepinephrine, and we were good. But the picture is much more complicated, and serotonin is also involved. And when we think about the role of monoamines in ADHD, we think about dopamine. It modulates reward processing, motivation, and noise suppression. And when we have deficits, they impair the ability to filter distracting stimuli. When we think about norepinephrine, we know that it enhances signal strength and arousal in the prefrontal cortex, and it is critical for sustained attention and executive control. And the new kid on the block that we've learned about with ADHD, serotonin, 5-HT, it modulates behavioral inhibition and emotional regulation, and deficiency is linked to impulsivity and complex comorbidities such as anxiety and depression. About 80% of people actually have comorbidities along with ADHD as adults, and at least three-quarters of them are psychiatric comorbidities. Anxiety and depression, as many as half of the people with ADHD may have those comorbidities. And especially when we're looking at anxiety, the clinical picture overlaps because a number of the criteria for ADHD are also criteria for anxiety. And often it's difficult to tease out what disorder is causing the symptoms. Let's think about shared hyperarousal. Now, irritability is one of those associated features with ADHD that people are thinking more and more about these days, and it overlaps with the criteria for anxiety. With anxiety, there's muscle tension and physical restlessness. Also, there's irritability. Both of the disorders have sleep disturbances. It's part of the criteria for anxiety. And with ADHD, we know that even though it's not part of the diagnostic criteria, that many patients with ADHD do have sleep disturbances. And we think about cognitive strain too, those internal symptoms. There is an internal mental chatter with ADHD that fuses with the negative, threat oriented loops of anxiety, and it leads to constant catastrophizing. And when we think about cognitive issues with ADHD, we think about the inability to regulate attention. But when people have trouble with cognition or attention with anxiety, it's often because they're in the middle of something and their mind goes blank because they're anxious. And then there's performance anxiety, those chronic organizational failures and missed deadlines that transform ADHD cognitive deficits into anticipatory dread and situational avoidance. When I'm trying to tease out, is this anxiety, is this ADHD, or both present, I use a number of screening tools. And I would never make a diagnosis just based on screening tools, but it's often very helpful, especially when I'm seeing people for their first visit and when I'm doing some follow up. One of the scales that I use is the Adult ADHD Self Report Scale. It's the ASRS version 1.1. The good news is it's free to use. You can find it on the web. The other scale that I use when I'm looking at anxiety is just the GAD-7. What kinds of questions do I ask? Maybe they're missing deadlines, as the patient in our vignette is doing. Are you avoiding your work because you just don't like to do things that take a lot of mental effort? Or are you avoiding your work because you are concerned that you're not going to be able to do it right? That it has to be perfect and you don't even want to start. You're paralyzed because you're afraid that it won't be perfect. And how do these work together? Well, one can make the other worse. If you think about anxiety, if you're stressed and you're not concentrating, as we talked about above, then it's going to be much more difficult to get work done. If you're afraid that you're going to get fired and you're calling in sick, your ADHD may be making your anxiety worse. And people with ADHD and anxiety can present with different symptoms. One of the clues that may help, especially if somebody is on the younger side, is if they have a lot of somatic symptoms.
Welcome back, Marissa. How have you been doing?
I've been okay, Dr. Song. I started the treatment we discussed last time, and though my ADHD symptoms seem to have improved, I'm still really anxious. In fact, my anxiety seems to have gotten worse.
I see. Can you tell me what's been happening? Has the anxiety been having an increased impact at work or at home? Marissa?
I- I'm sorry, I'm just not sure how to answer that question.
It's okay. Take your time. And you don't have to answer it if it's too difficult.
No, it's okay. I um I have missed a few days of work, but my boss has been really understanding about it. But I'm always afraid I'm going to make a mistake and get fired. I'm so worried about everything that I'm having trouble sleeping at night.
That's definitely something we need to address. How would you feel about discussing a switch to a different treatment, one that might better address your anxiety?
But the treatment I'm on now seems to help with my ADHD. Do you think it's really necessary to switch? I wouldn't want my ADHD symptoms to get worse too.
I know it's a change, but I do think a different medication may be more helpful for you and still address your ADHD symptoms.
But why didn't the first treatment work for me? Does that happen often? Maybe we started with a dose that was too low.
I understand your frustration. And to answer your questions, some patients may not respond to treatment with stimulants. Or, like you, their ADHD may improve, but they may experience more anxiety. Usually, we see a response to stimulants within a few weeks, and we tried the stimulant for a few weeks at an adequate dose, so increasing the dose may not be the next best step right now.
I see.
But please be assured that we will find a treatment that works best for you. Treating ADHD with anxiety can be tricky sometimes, and finding the right treatment really varies from person to person. But just because this first treatment didn't work like we wanted, doesn't mean we won't find a treatment that works better for you.
All right. How would the treatments you have in mind be different from the one that I'm taking now?
The medication you're taking now is a stimulant. I think switching to a medication that is a non stimulant might be the next best step right now and help address your anxiety.
That does sound promising. Can we talk a little more about the details?
Of course.
Think about treating ADHD. Often ADHD was there first, even though maybe anxiety got diagnosed first. And so treating with a stimulant may lessen the ADHD symptoms. As ADHD improves, anxiety may get better. But treatment with a stimulant may also worsen anxiety in susceptible patients. Maybe they've had a partial response, but their anxiety has gotten a lot worse. One of the things I would think about is if anxiety has gotten a lot worse, is maybe I'll switch to a non stimulant. And that may be difficult to get the patient on board, especially if their symptoms have responded a little bit. So it's important to explain the pathophysiology of ADHD and anxiety and discuss that symptoms may get better, may stay the same, or may get worse when they're taking medication. And it's a journey. The first thing that we start may not be the medication that they are on long term.
I was thinking we can try a non stimulant medication such as atomoxetine, viloxazine, or cintenafidine, which is pending approval and may be used later.
Okay, and how do these medications work?
All of them work on chemicals in the brain known as neurotransmitters. Atomoxetine primarily works in the norepinephrine system and increases its levels. It also has an indirect effect that increases dopamine levels. Viloxazine has similar effects, but it also interacts with serotonin receptors. Centanafidine works directly on all three neurotransmitters serotonin, norepinephrine, and dopamine. All of these have similar effects on ADHD.
Are these treatments like antidepressants?
An excellent question. And yes, there is some overlap between treatments used for depression and those used for ADHD with anxiety, as they can work on some of the same neurotransmitters.
And how do these medications work differently than the stimulant I was taking?
These treatments do not cause significant rapid increases in dopamine like a stimulant would, and may also help address anxiety. They may also take a couple of weeks to see an effect.
I see. And are there any side effects I should know about?
There's quite a list, but the most commonly reported ones are constipation, dry mouth, nausea, and decreased appetite, dizziness, erectile dysfunction, and urinary hesitation with atomoxetine. Some similar side effects have been reported with viloxazine, such as nausea and decreased appetite, as well as insomnia, headache, somnolence, fatigue, dry mouth, and constipation.
Okay. And the third treatment, what was that called? Senta.
Centanafidine. Patients taking this treatment have reported nausea and decreased appetite, headache, and dry mouth. Some patients also developed a skin rash.
And does one work better than the others?
No, not necessarily. We can work through the options together and find the best fit for you.
I would really appreciate it if I could think about this for a little while. Would it be possible to come back after a week so we could discuss further after I've had a chance to think about it?
Of course. And you can always call in the meantime if you have any questions about anything. Okay?
Thank you, Dr. Song.
We can think about atomoxetine as a selective norepinephrine reuptake inhibitor. And there are good data, lots of clinical trials. It's been out on the market since 2002. And there were two adult studies that were done for registration. And the ADHD symptoms were statistically significantly improved on atomoxetine as measured on the ADHD symptom score from the Conners Adult ADHD Rating Scale. Atomoxetine was also studied, used in ADHD with comorbid anxiety. There was a systematic review. There were 4 studies in children and adolescents. The studies reviewed, one of them showed there wasn't any statistically significant difference with fluoxetine. In study number 2, 9.4% improved over placebo with atomoxetine with the anxiety. Study 3, there are also some people improved versus placebo. And then in the 4th study with atomoxetine versus placebo, about 26% improved on atomoxetine and 14% on placebo. There are other non-stimulants too. Viloxazine is a little bit newer on the block. It's an old drug. It was actually on the market in Europe, used to treat depression in a short-acting version for about 30 years. Now, viloxazine is also a norepinephrine reuptake inhibitor. It's not as strong of a reuptake inhibitor as atomoxetine is. It's a dopamine modulator in the prefrontal cortex, and it also has some serotonergic properties. It is a 5-HT2B antagonist and a 5-HT2C agonist. And with clinical trial data in adults, we use the Adult Investigator Symptom Rating Scale for ADHD, and the total score was statistically significantly greater in adults treated with viloxazine than adults treated with placebo. Viloxazine has been used in patients with ADHD and comorbid anxiety, open label extension with ADHD and anxiety in the pivotal trial. And also, recently, there was a decentralized trial where patients were recruited via social media, and they were recruited if they had ADHD and significant anxiety and or depression. And what they found with this open label decentralized trial was that both ADHD, anxiety, and depressive symptoms got better when patients were treated with fluoxetine. Now some were also on stimulants and some were also on antidepressants, and those in every group got better. But we have to take it with a grain of salt because, again, it was an open label study and it was decentralized. And centanafidine is a serotonin, norepinephrine, and dopamine triple reuptake inhibitor. There are a number of clinical trials that were completed. Again, the adult investigator symptom rating scale was used, and it was a 6-week study. Adults had improvement in ADHD symptoms compared to placebo in both a low dose, a 200 milligram group, and a higher dose, 400 milligram group compared to placebo. And it has been used in ADHD with comorbid anxiety. If we look at rat data, serotonergic reuptake inhibition, those effects lend itself to anxiety management and a low risk of psychomotor agitation. Patients with high baseline emotional dysregulation saw greater improvements when they were treated with centanafidine compared to placebo, and these were pediatric studies. And children and adolescents with high baseline executive dysfunction experienced greater improvements in core symptoms and associated features. And that's really important because we know that more than a third of people treated with stimulants still have some executive dysfunction. So, in our vignette, our patients started on a stimulant and ADHD symptoms got better, but anxiety got worse. So, how would we transition her from a stimulant to a non stimulant? My thought is if anxiety is worse with the stimulant, I would just stop the stimulant and I would start a non stimulant. One of the things that we know is that patients with ADHD don't stay on their medications long term. And probably part of that is because of a lack of education and really a lack of fine tuning with their medications. If something's not working or something's making side effects worse, people just discontinue it.